Welcome to Day 9. Today we'll begin again with a guided relaxation exercise where, like yesterday, I will guide you through the first breath and then leave some space for you to repeat the exercise on your own. The important part is for you to try and release the tension in your forehead, face, neck and shoulders. So now, just focus on your breath. Remember to allow anything to occur on the in-breath. Thoughts, feelings or distractions, they are all part of the training. Just give the out-breath feeling your full focus when it comes around. Now breathe in, hold, and release. Breathe in, pause, release. In, pause, release. And now move your attention to your forehead. Release with the forehead. Now rest your attention over your face. And release while focusing on the face. Rest your attention over your shoulders. Rest your attention over your neck. And finally, rest your attention over your head and shoulders. Mind techniques for pain management have been around since time immemorial and are still used today, particularly in Eastern cultures. In Western cultures, it was only in the last half of the 19th century where anesthetics were used in surgical procedures, and hypnosurgery, that is, operations where a patient is sedated using mind techniques, was pioneered by a fellow called James Braid in the 1840s. The mind technique for pain management that you will be learning today is called pain visualization. It involves distancing yourself from pain by creating a picture or a vision of the pain as it is occurring in the body. The idea is to become an impartial observer, like an uninterested spectator of your own pain. Using this technique, you learn to treat the pain as a sensation rather than a thing that is unbearable and unmanageable. The first step in achieving this is to develop the ability to focus your attention on the pain area without creating tension in the body. This is what we were doing yesterday. Once you can look at the pain area without tensing, you can start to distance yourself from it and look at it in more objective ways. Some people find it helpful to give the pain a shape or a texture or even a color. Once you get good at that, you can start to manipulate the shapes, textures and colors with your breath and move them out of your body altogether. But that takes practice. In this exercise today, what we are going to do first is release any tension in the head, neck and shoulders, so we can start with a blank canvas. Then I'm going to ask you to focus on the area in your body where you are experiencing the strongest sensation. Then I will guide you back to your head, neck and shoulders to see if any tension has come up. And if it has, we will release that tension again with the out-breath. I will be carefully guiding you back and forth between the pain area and any area of your body where tension is likely to arise. The trick is to keep the body free of tension during the exercise. Remember, if at any moment you feel distressed or uncomfortable, you can press pause, tap your screen 3 times, or just stay focused on the breath and ignore the instructions. So now, just let me guide you through. Bring your attention to your face, forehead, neck and shoulders. Let your attention rest over these areas as a whole. If you notice any tension in those areas, then focus on the tension area and savor the feeling of release on the out-breath. Release the tension. We want to start with a blank canvas. Now move your attention to the area in your body where you are feeling the strongest sensation, where the sensation is bothering you the most. Let your attention rest there for a moment. Now check if your face has changed in any way, or if any tension has arisen in your head, neck, or shoulders. Release that tension now with the out-breath. Now return back to the area where you are experiencing the strongest sensation in your body. Release any tension in your body if it arises. Remember, we are keeping a blank canvas. Now go back to the sensation area. Try to notice where the sensation starts and where it ends. Focus on the edges if you can find them. Release any tension in your body. Get the canvas blank again. Now return to the sensation area. Observe it carefully. Is the pain area one big shape, or does it consist of a number of smaller pain areas clustered together? Notice whatever you can. For whatever area you notice, really see if you can map out its shape. Is the sensation radiating out? Now check your body for any tension and release it with the out-breath if it arises. Now back to the sensation area. Keep your body as relaxed as possible while looking at the area. Is the area changing, shifting or moving? Is it radiating? Is it one shape or a group of shapes? Can you define the edges? What happens to the area when you savor the out-breath? Keep releasing tension as you notice it. Between now and the next session tomorrow, if you find your pain is becoming difficult to manage, check your body for tension. See if you can notice and release any tension areas in your body. See if you can experience the pain sensations with a blank canvas. Today's session took a lot of courage. Even if you were not quite on board with the exercise, you were practicing courage, and so you have made some gains. Courage is an important factor in pain management. I'll leave you with a quote from Anais Nin. Life shrinks or expands in proportion to one's courage.